everybody, and welcome. We are very excited to have today a short interview with our friend Niki Munk, Dr. Munk, who will be presenting at the Alliance for Massage Therapy Education Educators Summit this coming July. You'll be speaking on July 28th. Is that right, Niki?
Yes, on the Friday.
Great. And what is the topic? What is your title that you're going to be speaking about?
So my topic is going to be specifically looking at how educators can integrate effectively and efficiently and successfully case reports into their foundation curriculum for massage therapists and also continuing education educators into their curriculum.
Nice.
So it's kind of interesting, that's the key aspect of my topic, but my overarching topic is going to be research, and case reports is the thing that I'm going to be focusing on. And massage educators, whether they be foundational educators, whether they be continuing educational educators, have a fundamental responsibility to integrate research into their education curriculum. It's not just something that's my opinion, it's something that is the opinion of the different leader programs in our field and the different agencies in our field, and then also the other healthcare professions and the public. They want research in. And sometimes it's a really hard thing for practitioners and educators to do. We have a lot on our plates as educators, and to be able to integrate research, not just from a consumer standpoint, but also being able to do it and bridge that gap is really, really important. And case reports provide a really great fundamental medium for educators to do that.
Well, you're preaching to the choir. You and I have a long history of looking at and discussing case reports.
Yes,
through our work with the Massage Therapy Foundation, and I think this is fantastic. What do you say to the educator who says, I have my hands full, I don't have an extra 40 hours in my curriculum to teach someone how to write a case report, and plus which I'm not, I don't have the competence or the confidence to help people do that. What do you say to them?
Sure. Okay. So aside from the 40-hour piece, because it's not a 40-hour focus, because when the curriculum says you have to have 40 hours of research, that's not just case reports, right? That's all manner of different ways that you're going to be considering research. But case reports can be integrated into the education, and not just how to conduct them and how to write them. But when you're teaching folks about the critical thinking about treatment design, why is it that I'm doing what I'm doing? Why is it that I am making the decisions that I'm making? And how is it that I measure the outcomes and talk to my clients about the outcomes that they're experiencing? How can I do that? Well, you can actually go to the literature for some really not just common things that massage therapists encounter in practice, but some of the really interesting and diverse and different complex situations that practitioners experience. And you can point to these things that have been written up and talk about and discuss, well, what do you think? This is why they made these decisions. This is the literature and the information that they were basing their clinical decision-making pieces on. And what do we think? Would we have done something different? What were they missing? What sort of things could be done in a different sort of situation? And it provides a medium through which educators, whether they want to talk about research at all, it provides a medium through which they can actually talk about what is happening from an evidence basis in the field and in practice, and how students can start putting those critical thinking pieces to task, and how they would address and approach somebody coming to their table. Now, from writing a case report, I know, right? I can do this.
Are you excited about this, Niki?
Maybe a smidge, because this is the thing for me. I'm no longer a practicing practitioner, which I really, really miss. I'm also no longer a formal massage educator. But as a former educator and practitioner, I still hold my license. I still do these things. I have to stay connected with the massage field, and this is the way I do it. I do research in massage, clearly, but I want to stay integrated and working with practitioners and with educators. And case reports is such a great way to do that. Well, all manner of research is, but I'm focusing on case reports today. So it provides a great medium to do all of these things. And the thing that I want to do in our workshop is address those barriers that educators may have and those sort of apprehensions that they may have. I don't have time, I'm not interested, I don't have the skills, or just it's not important. And I'm not only going to talk about some of the key components to being able to integrate it in, but I'm also going to bring evidence into the classroom when I'm talking about this, because case reports is actually an area of my research. So I've done an audit of all the different massage case reports that are written by practitioners, and I've looked to see how they've been reported. What is it that they're doing? But a really interesting piece that I'm going to be bringing in that hasn't been published yet, but I've finished the study and it's in dissemination now, is actually looking at all the adverse events, case reports that have been written since forever, since I didn't have a start date on this, and looking at all those adverse events, all the bad things that have happened from massage therapy. And I tell you what, how many of those massages were actually done by massage therapists?
Yeah, I run into this because I tracking adverse events is sort of part of my job as well.
Yes.
And I will say for our listeners for this interview, typically those case reports are not written by massage therapists. There's
not one written by massage therapists. Not one of the adverse events. Well, at least prior to 2015. I haven't looked at 2016, 2017.
I'll cover that for you. Yeah, it's the same. So, who ends up reporting on this are the doctors and other healthcare professionals who sort of clean up after mistakes or bad outcomes.
Supposedly by massage therapists. And that's the thing, is that when massage therapists are not involved in these sorts of case reports and these sorts of these reportings, the implication still falls on the massage therapy field. If we as a field are not the ones that are out there talking about what we are doing in our practice, what our outcomes are, what our potential adverse events are, all of these pieces, somebody else is going to be ruling that dialogue. It is imperative as practitioners and then as educators that we are equipping our future and current practitioners to be able to be the ones having this dialogue. That is one of the main pieces that I'm going to be talking about in this workshop. And yes, you're right, Ruth. I'm so excited.
Well, I'm really, really excited to come and see you. So thank you so much for taking some time out of your busy day.
Absolutely.
I'm a little disappointed that we didn't have a crashing tumble of children come into your room. So.
Oh, that's only because you didn't hear Scarlett outside the door. She might have even been naked getting ready for a bath, because we could have had one of those moments. I've got two small critters. They're great.
Next time. All right. Thanks so much, Niki. We'll see you on July 28th in beautiful downtown Tucson with the Alliance for Massage Therapy Education Educators Summit.
Absolutely. I'm looking forward to it, Ruth.
Yeah, me too. Bye-bye.